Japan has sounded the alarm as COVID-19 cases surge past 10,000, the highest since the start of the pandemic. But Olympics organizers say there's no link between the rising cases and the Games. Shuhei Nomura from Keio University in Tokyo joins us for more on this. Mr. Nomura, cases skyrocketing in Japan. Why aren't restrictions working?
Yes, the number of COVID-19 infections is increasing in Tokyo and other prefectures. And in Tokyo, a state of emergency has already been declared more than 2 weeks ago. But we have not observed the positive effect in reducing the number of infections. And I think one of the reasons for this could be that the human mobility has not been well decreased after the declaration of the state of emergency, because this is the fourth time that a state of emergency has already declared and the people have become accustomed to living in such a situation. And there's not much difference between the normal life and the life under the declaration for most people. So there may be a little change in their daily behavior.
Mr. Nomura, we are seeing a surge in infections in Japan. So why then is Japan's top medical association saying that there is this lack of a sense of a crisis or an urgency in the country?
Yeah, I don't think so. I think that many people worry about the Delta variant can be the driving factor of the recent outbreak in Japan.
Are there any other concerns besides the Delta variant, the Olympics perhaps, though the Tokyo event organizers are saying that it's not connected to the numbers that are growing in Japan?
Of course, the Delta variant has a big impact, and now in Tokyo, 50% of the new infections are considered to be Delta variant. But yes, the Delta variant is not only the cause of the current increase in the infections. And I think another reason may be the human mobility, which has not been decreased after the state of emergency, or it has even increased in some places. And also, I think the low vaccination coverage against COVID-19 is an important issue in Japan. The vaccination against COVID-19 has just started in Japan a few months ago, and the number of people who have completed 2 doses of vaccine is still less than 30% of the population. And even in many countries with higher vaccination coverage than Japan, the number of infections, which had dropped once, but it's now increasing again, and possibly due to the Delta variant. So the low vaccination coverage in Japan may have some impact on the spread of infections.
Mr. Nomura, the concern is always with this COVID-19 pandemic, the impact on healthcare systems. So what about Japan's? How is its healthcare system coping with this surge?
It is a very difficult situation. Some medical institutions in Tokyo have already reported that the number of beds is already full. We are, of course, making efforts to expand the number of beds, but yeah, I think we are in a very difficult situation.
A very challenging situation in Japan. Mr. Nomura, thank you very much for that, joining us. Shuhei Nomura there from Keio University in Tokyo.